Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. The episode today is called What Should I Call Myself? Because I am asked that question all the time. As I started to write notes for this episode of what to talk about, I realized that it's a little bit more dynamic of a question to answer than I had initially thought. If you haven't listened yet, I have a couple previous episodes that kind of tie into this one. One of them explores the topics of functional medicine versus integrative medicine versus lifestyle medicine and the term holistic nursing, and another episode that compares functional nursing to functional medicine. So if you want, you can go back and listen to those full episodes for more detail on those terms specifically. I'll give you a brief overview here though. Functional medicine, our bottom line is looking for the why. And so we're really personalizing care for people. When we use integrative medicine, we're saying that maybe we work in a setting like a primary care office where a lot of patients are on prescription medications, and we might work in a corporate healthcare setting. So in those cases, patients might choose to prefer a more allopathic or conventional option for their treatment, or they may seek some advice that more aligns with functional medicine. And so we call that integrative medicine when you're kind of offering both, or you're in a setting where you might practice more holistically, but you are also offering conventional options quite a bit. Lifestyle medicine is a term that kind of has like this ultimate, like, what is research saying is the very best that we can do for our bodies. And so that it really aligns with functional medicine also. You know, we can use research and recent studies to confirm what might be the best guidance that we can give to patients. And in that way, lifestyle medicine I see is this like level of perfection, right? It's like the very best version of things that we can do. Holistic nursing, I think, is an important term to acknowledge here too. And you may know holistic nursing essentially is defined as a nurse that is considering the whole patient in their care. So we're not just thinking about the heart when we're taking care of somebody on a cardiovascular unit. We're thinking of their entire body. Nurses are trained this way. I think that's how our brains work as nurses, is to think of the whole person. It's never just that somebody is out of a medication and they're therefore non-compliant. There's the dynamics of, you know, were they able to afford it? Were they able to go pick it up? Did they understand that they needed to take it? You know, whenever a nurse, I think, approaches a problem with a patient, we have a really unique way of viewing it that encompasses lots of dynamics of somebody's life and not just, in that example, compliant or non-compliant. And I think that's one of the reasons that nurses are so special, is because we do try really hard to consider the unique individual in front of us. And that's also why I think that holistic nursing and functional medicine are nearly synonymous. So that brings up my second little thing I wanted to mention some terms is functional nursing versus functional medicine. As I mentioned, I have a whole episode you can go back and listen to on that topic. But the bottom line is, you know, what we're doing as nurses in this field is not truly medicine, right? Most of it is nursing care. It does raise the question, should we be even saying that it's functional medicine? Because it truly is nursing. And in that episode, I talk about the fact that I think that's a really valid point. I think you could call yourself either. You could say you're a functional medicine nurse, or you could say that you're a functional nurse. My only point that I really think is important to consider right now is that even though functional medicine has been around for decades, it's still quite young, and building a reputation and respect for functional medicine is growing. And I think that aligning with that right now has quite a bit of value to it. And so that would be my only argument for saying functional medicine versus functional nursing. And if you look up functional nursing online, it kind of also goes into this realm of like how nurses do what they do, which is interesting. It's a different topic if we go there, but I thought that was interesting when I looked it up. I have students that ask me about being able to use different terms when they're practicing functional medicine or holistic nursing and what they want to call themselves. So the terms I just went over come up quite often. A nurse may call themselves a functional medicine nurse or a functional medicine nurse practitioner. They may work in a setting where integrative might be a better term for what they're offering. Some nurses tell me, that they work in settings where using the term functional medicine might create some friction. And in that case, I think holistic nursing is a really great term to use. And I also think that sadly, it isn't as offensive to other practitioners that might otherwise find some be skeptical about what you might be offering. I think holistic nursing really conjures more of an image of nurses doing what we do best, thinking of the whole person, maybe a little bit more of a focus on lifestyle type practices. Leading back to that is that some of my students have decided to call themselves a lifestyle nurse because they want to be certain they're not implying in their practice that they will be offering any testing or lab work or prescriptions or anything like that. And so I think lifestyle is a great term to use if you are trying to make a distinction that you will be almost exclusively focused on nutrition, stress, sleep, avoiding toxins in our lives, mindfulness. And so all of those are appropriate terms. And I encourage all the nurses that I talk to about this topic to really think about what they want to convey with their title. I used the term when I started my private practice. I was leaving primary care, and I decided to use the term consultant on purpose. I chose to word it that way to make it clear that I'm consulting and I am not continuing to do any primary care. That has worked really well for me in finding a way to draw a line in my community from what I was offering previously, which was a lot of integrative care. It was a lot of conventional mixed with my holistic perspective. So you could choose to use any of those terms. I chose consultant because I felt like it made that distinction that I needed in my community to no longer be a primary care provider. If we look at the definition of the term consultant, it is a person who provides expert advice professionally. And so that is not implying that you are offering medical advice. It is not implying that you are stepping outside of your scopes whatsoever. Nurses are experts in their field when they have, what's the definition of expert, I believe, for nurses tends to be somebody who's practiced for more than 5 years in their field. And I think, there's more nuances to that definition, but just to point out that absolutely nurses are experts in their field and they can provide professional consultation for that. Unless there is any restrictions in your state with your scope of practice, which I have not encountered. That doesn't mean it's not the case, but I haven't encountered that where any students have found that they cannot use the term consultant when describing what they offer. So you can be a nurse consultant. Think about the fact that a lot of nurses are legal nurse consultants, and so they're using that term already. The other term that I think a lot of nurses get caught up on is being a practitioner. And the definition of practitioner is someone who practices a learned profession. So I hope just in that short sentence that clears that up for you. I am a nurse practitioner. That is a term that has become a common way to describe the field that I work in. But nurses can be practitioners. So you can be a cardiovascular practitioner when you are a nurse, right? But you're working in the field of nursing. So we wouldn't want to imply. I think a really great example that I've heard a lot is nurse practitioners that are trained in pediatrics can call themselves a pediatric nurse practitioner. They should not be calling themselves a pediatrician. That term is specifically reserved for medical doctors that have been trained in pediatrics. So, we have to look at what our name is going to convey, and it can really inform our audience or our potential patients on what we might be offering them. Another thing to talk about here is certification. So in functional medicine, a lot of my students will take my course and then they take advantage of the really huge discounts that IFM offers to them to become certified. And that is the certification, that there are other ways that you can become certified in functional medicine currently. That is the one that when I look to see what jobs are being offered, if somebody's looking to be hired in functional medicine, the IFM certification is certainly the most respected. And so I encourage my students to seek the IFM path and do their certification because I see where that has the most value for them to potentially be more appealing applying for jobs in the future. And I personally have done several programs and I really appreciate the expert educators that IFM uses and the evidence base that they bring their education from, how on top of things they are about the strict standards they hold themselves to for offering really respected guidance that we can feel comfortable sharing with our patients. So at the moment, that's the case. The caveat to that is that, nurses historically get their certifications as nurses. So if you are a critical care nurse, an emergency room nurse, a school nurse, a nurse educator, we get our board certification through a credentialing agency that certifies us as a nurse in that field. And I think that there's a lot to be said for that. My best example is, when the Integrative Nurse Coach Academy brought to light this idea of nurse coaching, and nurse coaching was in its infancy. That wasn't very long ago at all. And there certainly wasn't a board certification for it initially. That happened pretty rapidly, I feel like. It didn't take long at all for there to be a board certification through the AHNCC to be a board certified nurse coach. So I did the Integrative Nurse Coach Academy's nurse coaching training, and then I was able to sit for that board. You can also, at the same time, if you do that one, do the combination one that board certifies you as a holistic nurse, which I think really aligns with functional medicine and might be a path that a lot of nurses find to be their preference to validate what they have learned. That is how to get certified in functional medicine right now and to say that you're certified. So this all lays the foundation to answer the question that I get asked all the time is, I call myself a functional nurse or a functional medicine nurse. When can I call myself a functional medicine nurse? What I tell my students is that you can start saying that you practice functional medicine as a nurse when you can answer why, or you start asking why, sorry. So when you start asking why about your patients, why is this going on? Why do they have this set of unique symptoms? What has been going on for them? When you're really looking for the why, that is what functional medicine is all about. And so you might not have all the answers yet, but I feel like approaching things with that level of inquiry is the definition to me of functional medicine. And I also say you can start practicing functional medicine, incorporating things into your practice when you can tell your patients why. And so the whys are something on my list that I'm always thinking about when I'm talking about this. When can I call myself a functional medicine nurse? But the real distinction is that I think that because you can do the training through IFM, a lot of nurses are like, okay, at what point can I say that I'm a functional medicine nurse? The thing is, I think the hang up is on becoming certified. And I think that us being able to confirm that we are an expert in our subject matter is really important. I also want to point out that if you work in an emergency room, you probably tell people you're an emergency room nurse. If you work in a school setting, you probably tell people that you're a school nurse. If you're a holistic nurse, you can say you're a holistic nurse. You can also go on to confirm that you're a really great one by getting a board certification. And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on-demand contact hour courses to the full functional nursing program, designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. If you're looking for connection and real-time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. As a school nurse or an emergency room nurse, as a nurse coach, you can earn the title board certified in that to say, I am a board certified emergency room nurse. Even as a nurse educator, like I'm a certified nurse educator. And that is a board certification that you have to sit for to confirm that you have the training to provide education. And it's just, was I an educator before I took the exam? Absolutely. Did the exam help validate for me that I'm trying to do my best to be a quality educator for nurses? Yes, that was my goal there. And I think, in all avenues of nursing, we have certifications, but, functional medicine's pretty new for nurses. And so that certification isn't available yet for us specifically for our profession. In the meantime, I do recommend the IFM one, but I wanted to make that distinction because that is the big question that people ask me. Can I say that I'm a functional medicine nurse or a functional medicine nurse coach? If you're practicing it, if you're asking why, if you're educating your patients, you are a functional medicine nurse. You are not a board certified functional medicine nurse. So that is the difference. When I started this episode, that was kind of the end of the story. And I was like, oh, this isn't going to be a very long episode. But there's a little bit more that I want to talk about on this topic. And so I want to shift gears. I also want to point out, like I always try to say when we talk about these topics, is anything that you're going to be doing to like start your own practice, putting your hard-earned license at risk, I really think that you should run by a lawyer and make sure that you're following the rules that are specific to your area. So whatever your state rules are for practicing as a nurse or a nurse practitioner, really keep in mind that I am not doing research specific to your community to find out what's appropriate. On that note, by shifting gears, I wanted to bring up a question that has come up with students lately. I've had a lot of students ask me if they're even allowed to have their own business. I think I talked about this in an episode recently where they're wondering if they're allowed to own a business because they're a nurse. And I just think that's bonkers. That culturally, we have been convinced that we can't do things. And I was asking somebody the other day, who that isn't a nurse wonders if they're allowed to start a business? But that is where we're at, right? We're worried that somebody's going to come after us or we're going to lose our license for things that we do, even when we're 100% working in our scope and we have the best intentions and we practice very safely. And so that's a question that I want to pose for you. You know, the American Medical Association, if you look up the history of nursing, nurse practitioners, licensing titles, collaborative agreements, oversight in states, the American Medical Association has really spent a ton of money to make certain that physician groups are controlling what nursing practice looks like in various states. And that is the reason that we have this dynamic variation in whether a nurse practitioner in one state can take full care of a patient versus a nurse practitioner in another state. And if you look at all the research where we compare outcomes for nurse practitioners and physicians working in the same setting, providing the same level of care, nurse practitioners have great outcomes, and there's no evidence that has come forward to say that nurse practitioners are this great risk to their patients. They take wonderful care of their patients. Of course, there's always going to be unique stories, and I'm sure as a nurse, you know some unique stories about some physicians that have done some things that make that questionable as well. So I think, it's important to note that we have lobbyists trying to make certain that we don't gain more rights as nurses and nurse practitioners, and we don't talk about that enough. There's the issue of nurse practitioners in many states cannot introduce themselves as a doctor. They're not allowed to use that title. And that drives me bananas. I think that's insane. Nurse practitioners with a terminal degree, a doctorate, should be allowed to introduce themselves as a doctor exactly the same as a physical therapist, a pharmacist, a physician, a veterinarian, a dentist, a professor. Anyone that's an expert in their field and has earned a terminal degree has the right to call themselves a doctor in all other practices. But for some reason, physicians are really upset that nurse practitioners might somehow confuse people by introducing themselves as having a terminal degree in nursing. I know that they argue that there's a risk for harm to the patient. I don't see that at all. I see that nurses are either going to practice within their scope or they're not. Patients, I took care of many, many patients. I had a panel of over 1,000 patients in my primary care practice, and I would introduce myself as a nurse practitioner. I did not have a doctorate yet. And if they called me doctor, I would try to correct them, educate them, tell them what my role was. If they had questions, I would try to answer them. But, they cared about the amount of time that I spent listening to them and the type of care I offered them. They weren't really worried about titles. I made sure that what I did was always what I felt was in their best interest and aligned with their goals. I think that it's an interesting thought that physicians have somehow taken the word doctor and feel like they own it as a group. And so one thing that I want to plant the seed of in this conversation right now is that we all stop using that term to describe physicians, and we use the term physician only. So somebody's a medical doctor, they're a physician, they are not the only doctor, right? Like there are lots of types of doctors. And when we shift our culture where we make it clear that we're talking about physicians, when we say you're doctor, we say you're physician, you're nurse practitioner. But when we address someone with a title, it's a measure of respect. And so calling someone with a doctorate doctor is respectful. And I think that's important to acknowledge. In all of my time working as a nurse practitioner, there was never a time where my goal was to claim to be a physician or trick anybody into thinking that I was a physician. I honestly argue that the care that I provide, I think is of the highest quality based on what I have learned. I want to practice as a nurse. I want to view people holistically. I want to be a really great listener and consider the whole person and their family and the things in their lives that may be contributing to their conditions. I 0% am interested in just listening to a set of symptoms, diagnosing somebody and prescribing a medication or sending them off to surgery or whatever the case may be. The medical model does not align with who I am, but I'm a few months from earning my doctorate. And it has come up many, many times in my career that nurse practitioners aren't allowed to use that title. I'm not in any way doing this episode for that to be regards to me. It just came up for this particular episode that, what should I call myself? What can I call myself? That I wanted to mention. We all need to start using the term physician, in my opinion. I think that would really help to promote other types of practitioners and experts in their fields that have earned the title doctor. And we should pose that question, why is it that every other specialty that has earned a doctorate is allowed to be called doctor? I would never think of not calling my dentist doctor and their name because they're not a physician. That just, and I've worked with many, many veterinarians before I became a nurse, and they're my most respected profession. I love them, and they have absolutely way beyond, I feel, most medical doctors earned their doctorates by being able to work on all types of animals. I think that they deserve much more respect than they get in many cases. Anyway, so the last thing that I wanted to make a distinction of in this is people will ask me about the different types of doctorates that nurses can get. So we have a DNP versus a PhD, and I wanted to make a distinction there. A few years ago when I decided to get my postmaster's doctorate, I was choosing which of the two I wanted to complete. And for those of you that might be in the same position or you're thinking of starting a nurse practitioner program that might offer one or the other, the distinction for me came as I was learning functional medicine. I saw that what happens in functional medicine is we take research and interpret it and apply it to practice. And in practicing functional medicine, you really have to be savvy in doing that. We do that through the course that I teach because I want nurses to be able to look and question at various aspects of research to really decide if the study was even built and implemented in a way that would get them information they're looking for. So a doctorate in nursing practice, a DNP, is what I'm earning. And I chose that one because it is about taking current evidence, doing research and applying it to practice and then measuring outcomes. So taking research that's been done by researchers and figuring out what best practice might look like if we were trying to improve maybe a current problem and applying that in a setting like a pilot study and seeing the outcome and then making a distinction there. Like, was this something that we should apply on every unit of the hospital because it went so well on this first unit? Or is there something we would need to consider if we were going to apply it in a different setting? So a DNP is really about improving nursing practice. It is a doctorate in nursing practice. So you're trying to learn to, with expert eyes, look at research and look at a current problem and work on a way to fix it. And that I felt was most appropriate for me. And what I want to do in the future is continue to interpret quality research and help my students learn what might be the next best thing to try to implement. The PhD, on the other hand, is a longer program, and it is more about actually performing real research. And so those are really different. So when I'm looking at research in my DNP program, I'm looking at research that's typically been done by PhD researchers. So those are completely different degrees. And depending on what you might be interested in as a nurse, one of those might appeal to you much more than the other. So I thought that kind of aligned with our what should I call myself? Do you want to do, if you were going to work towards a doctorate, would you want it to be more in practice or in research? And I think, that's everything I really wanted to share on this topic. I hope that it has answered questions for many of you that are wondering what to call yourself as you're learning functional medicine. I think lately, more and more, I feel like I'm becoming more and more aware of the impact that we as nurses can have in shifting healthcare, doing what I have learned in functional medicine, what I teach, what my students are talking about and fired up about is, we need a cultural shift. And part of that is away from nurses feeling like they graduate school where they've learned to be a holistic practitioner only to work in a model that is really medically driven and focused on medications and surgery and corporate healthcare. So I encourage any nurses listening to really participate in that cultural shift. We need to change the way that we look at our own practice and to change the way that we talk about what we offer people. There is so much value in us offering something that is so personalized for people, and to approach them from a holistic viewpoint and offer the education and spend the time with people that we tend to as nurses compared to the medical model. And I think the more that we can really see the value in what we're offering and how much potential that has to improve patient outcomes, shift our healthcare crisis in a better direction, I think that that's our job to do. Nobody's going to do it for us. And so I hope that this episode was helpful for you if you've been wondering about titles, and hopefully clarifying. And again, I encourage you to look back at those previous episodes if you want more detail on the terms I used at the beginning of the episode. But until next time, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.